Okay, we are talking about Hallux Valgus and going through a case study. We're here at the Orthotics Builder page. If you're on the home page, this is the link right here, Orthotics Builder, that'll get you to this page. Okay, I'm already on it, but so it'll just refresh it there. So here is the place where we build the orthotics. What we have here is a 47-year-old, 140-pound female secretary who has developed painful bunions bilaterally. She has osteoarthritic changes in both the first metatarsal phalangeal joints. Arches are low. She is pronated during gait. Stands in calcaneal valgum, and she has worn heels on her feet at work for the past 25 years. First thing, we need to talk to her about getting something that is not pinching her toes on her feet. There's two things with the heel. That you raise the heel up and it puts more pressure forward onto the foot, and also they are often more of a pointed toe, which enhances the hallux valgus position. When she needs to have something reasonable on her foot, something that will fit a foot orthotic. You could fit her with a regular shell and a half-length top cover, even vinyl. This would be the ideal dress orthotic. It's the most low-profile orthotic that we have. In her case, I mean, I tend to gravitate away from these as much as possible. I would really try to convince her to get into a better shoe, go with a full length, we'll say 16th, which is just a little bit thicker. Still gives some options with shoes, so you don't have to go with a major orthopedic shoe. You need an account number for all of these in order to order anything. So in order to get that account number, if you don't have one, you need to fill out an application over here. So that is something that you can take a look at, and once you are approved, then we would give you the account number and go from there. Bottom covers, in this case, I would go with a 4-foot vinyl reinforcement. Metatarsal pads, no. Heel pads, no. Scaphoid, no. And heel stabilizers, no. Morton's extensions, or 2 to 5 extensions. Now, oftentimes we're not going to put one in this person's orthotics if the assessment showed that she had restricted movement into extension at the first metatarsal phalangeal joint, which is very common for osteoarthritic first MTPs. Then we may want to try these extensions because they will allow the first MTP to drop towards the floor just a little bit before it has to bend. You know, as the heel starts to pick up, the MTP drops down into the space left under the first metatarsal, because the 2 to 5 extension is an extension under metatarsals 2 through 5. So metatarsals 2 through 5 here. Okay, in this area, you have this first, where the Morton's extension is shown here, would be a bit more space for the first metatarsal to drop in. As the heel comes up, it drops down a little bit before it has to bend. If you didn't catch that, you can always call me and ask me about it, or break out some textbooks. Alright, so in this case we're going to put none. We have no indication that she has any problems with that movement according to the case study. Rear foot posting, I'm going to post her bilaterally. Again, the varus post, the amount 1/16 or 1/8, which is either 1.25 millimeters or 2.5 millimeters approximately. The amount is according to what you see on assessment. If she's a really aggressive pronator with a major hallux valgus and a rear foot varus deformity in non-weight bearing, then we could post this a little bit more aggressively. This is what I'm using for the purposes of this demonstration. No 4-foot posting, and shoe size is irrelevant, so we'll just stick something in there. So that's how I would build a foot orthotic for this patient with Hallux Valgus. We have a device that looks something like this, without the metatarsal pad, without the calcaneal support pad. Okay, and to finish the order, just hit add to cart, and there you have it. This is a fairly low cost, simple orthotic, but it can do wonders for someone with Hallux Valgus, especially if the reason why they have it is due to the pronation, and even if that's not where it originally came from, it oftentimes will aggravate it and contribute to it. So we correct the pronation, and they should see some relief in that area, as long as they are wearing a shoe that will accommodate it. To continue on with the checkout, you just hit checkout and then fill out the forms and go from there. You can see this HTTPS indicates that this is a secure page, and so will the next page be where you enter your credit card information. So if you have any questions, make sure you contact me. Here's my phone number up here. Leave a message if you don't catch us. As well, down in this area, you can use a contact form, email contact form, and that's it. Hopefully you will talk to us soon. Make it a great day.